I'm Angela Dunn, and my story from the field is about connecting public health data with school attendance data. Public health having access to school attendance data came about during the COVID pandemic when we had lots of cases and there were triggers for interventions that depended on how many kids in school had COVID. And having that attendance data really facilitated our public health process. We were able to use data automation in order to identify kids that were in school that had COVID without having to call the school nurse to determine whether or not the kid was there and how many classes they'd been in and all those things. We were able to just do that by looking at attendance records. So improved our processes, decreased staff time, both on the public health side and the school side, allowing us to really do our jobs more effectively. In terms of the community, we were able to keep our schools open because in Utah, we had triggers. If we had a certain number of kids with COVID in a school, the school had to go remote. Because we were able to identify kids with COVID quickly and make sure that they weren't in school, we were able to stop the spread of COVID within that school setting and make sure that schools stayed open for in-person learning. So it really helped our community be as normal as possible while being as safe as possible during the COVID pandemic. At the Salt Lake County Health Department, for this specific use case, we had a whole team of just school-specific contact tracers. And so them having access to attendance data really empowered them to be able to have quick interventions that basically saved lives, but definitely prevented the spread of COVID throughout our schools. The whole concept of data modernization is exciting. Public health is not up to speed with the rest of industries, and we owe it to our communities to really level up what we're doing. This attention that has been placed on public health from our communities, our elected officials, even industry, to do more with faster, better quality data is really exciting because that will only make the work that we do in public health more effective. And ultimately, that's our goal.